Cupertino Senior TV Productions is pleased to present a discussion of the June 2012 ballot propositions by the League of Women Voters of Cupertino-Sunnyvale.
Proposition 29 proposes to increase the excise tax on cigarettes.
Aren't cigarettes already heavily taxed?
Yes, a lot of the price of a pack of cigarettes is taxed. There's just over $1 of federal excise tax, and that goes mainly to fund the Children's Health Insurance Program, which provides subsidized health insurance for children in low-income families. In addition, there's currently 87 cents of state excise tax per pack. So for a pack of cigarettes costing something over $5, $1.87 is currently already state and federal excise tax. Now, the state taxes, like the federal tax, have gone up several times over the years, and they support a variety of programs. Some just goes into the general budget. Some is the result of more propositions like this one. Proposition 99 from 1988 is responsible for 25 cents of that 87-cent total. Its funds are used for tobacco education, tobacco-related disease research, healthcare services, and environmental protection. Then you've got the Breast Cancer Fund. That takes 2 cents, and it uses it for cancer screening for low-income women and for breast cancer research. Proposition 10 from 1993 gets 50 cents a pack. That supports early childhood development programs. So that brings us up to this year and Proposition 29. So if Proposition 29 passes, state excise tax on cigarettes will go up by another $1 per pack. And there's already a state law that says anytime cigarette taxes are increased, all other tobacco product taxes go up to match. And the tax on the other tobacco products goes into the Proposition 99 basket, if you will. That's the one that supports a lot of different things: research, prevention, healthcare. For right now, let's just talk about the cigarette taxes. So of that new dollar in excise taxes, 60 cents will go to research on diagnosis, prevention, treatment, and cures for cancer and tobacco-related diseases. 15 cents will go to capital equipment and facilities for research on tobacco-related diseases. 20 cents will go to the Department of Public Health and Department of Education for programs to either help people stop smoking or discourage them from ever starting. 3 cents will go to law enforcement toward efforts to reduce cigarette smuggling, tobacco tax evasion, sales to minors, that sort of thing. And that leaves 2 cents left for administration.
Is cigarette smuggling a big problem?
It's not huge, but it tends to get worse whenever the tax goes up. As the tax on cigarettes goes up, people will either smoke less, which is what the backers of the tax are hoping for, and it is what most people tend to do, or they will look for a source of tax-free cigarettes. In any case, the forecast is for this proposed increase to decrease the number of packs sold. So accordingly, some of the money raised by the new tax is allocated to replacing money that the Proposition 99 and Proposition 10 funds lose as a result of 29's passage. The Legislative Analyst's Office bases its revenue estimates on its best guesses about smoking reduction, cigarette smuggling, whatever other factors they can come up with, to come up with a realistic estimate of projected revenue. None of us has a crystal ball, but the legislative analyst does tend to be very good.
So what kind of numbers are we talking about, and who administers the money?
Well, the Legislative Analyst's Office estimates the state will take in about $810 million annually in new revenue as a result of Proposition 29's passage. About $75 million of that will go to make up for the losses in other funds as a result of fewer packs being sold. So that leaves about $735 million to go to the goals of Proposition 29. Now, since tobacco use is steadily declining, and may decline even faster with the price increase, we have to see this as a shrinking revenue stream. It's going to go down over the years. Those funds aren't really in the state budget. They can't be administered by the legislature at all, and they can't be lent to other state funds. They are administered by a 9-person committee. 4 of those committee members are appointed by the governor, and 3 of them are directors of designated cancer centers within California. 2 members are appointed by the director of the Department of Public Health. One of them has to have been treated for a tobacco-related illness. And the remaining 3 members of the committee are chancellors of University of California campuses that are members of the Institute for Quantitative Biosciences Research, which at the moment would make that the chancellors of Santa Cruz, Berkeley, and San Francisco, because those are the only UCC campuses that are members. So you have this committee, and it then draws up financial plans. It creates a procedure, all the procedures for awarding grants for research, hire staff as necessary, and set intellectual property policies for the funded research. The committee also needs to issue an annual report to the public on what the main money's being spent on and what the research looks like. Now, because this proposition can affect retail sales, it affects things like sales taxes, right? Fewer packs sold, but at a higher price. So it's estimated that state and local sales tax revenue is going to go up a little bit, $10 or $20 million or so, if Proposition 29 passes, taking all those variables into account. That's a really rough estimate. Other financial effects are even harder to pin down, because if fewer people are smoking, healthcare costs from tobacco-related illness are going to go down. Great. That affects the state, not only as a public health matter, but because it's the state that provides health care for the poor and uninsured, and health insurance for its own retired employees. On the other hand, those same people might now live long enough to get sick from something else. So the effect on total health care costs is really a complete unknown. So who likes this proposition, and what do they have to say?
The arguments in favor are signed by the American Cancer Society of California, the American Lung Association of California, and the American Heart Association, Western State affiliates. They say that taxing tobacco saves lives by discouraging teens from starting to smoke and encouraging smokers to quit. They say that the proposition generates hundreds of millions of dollars towards cancer research, and that money is paid only by smokers and can't be touched by politicians.
And who's against it, and what are they saying?
On the con side, we have the California Taxpayers Association, the Hispanic Chambers of Commerce, and a former president of the Golden State Medical Association. They say this proposition raises taxes without cleaning up the mess in Sacramento and allows the money to be spent outside California. They say it forms yet another bureaucracy with insufficient accountability, and they say it provides no new funding for cancer treatment.